Entered the room, check for the scene safety. There are no hazards. I'm happy to approach. I draw the curtains for patient privacy. As my hands are visibly clean, I'm going to use the alcohol hand gel, ample amount, palm to palm, palm over the dorsum, palm over the dorsum, fingers interlace, fingers interlock, thumb rotation, tips of the finger, wrist to elbow, and allow my hands to dry for 30 seconds. Hi, good morning.
Good morning.
My name is Saima. I will be your nurse looking after you today. May I know your full name, please?
Josephine Noble.
Josephine Noble. What would you prefer to be called?
Josephine.
Josephine. Okay, Josephine. Do you mind if I confirm your details with your ID band and the notes I have here?
You can go ahead.
Can I check your ID band?
Yeah, go ahead.
Okay, please give me your full name again.
Josephine Noble.
And your date of birth?
14/11/1939.
And your hospital number is 004678. Okay, Josephine, do you have any allergies?
Yes.
What you are allergic to?
Penicillin.
Penicillin. And what reaction do you get from penicillin?
Anaphylaxis.
Anaphylaxis. Okay. So I will make sure that I will not give you any penicillin containing products while you are here in the hospital, and you are having a red band as well, so it will alert everybody. Okay.
Yeah.
Thank you. And Josephine, I'm here to get a set of observations on you, and before I do that, I just want to ask, do you know why you are here in the hospital?
Yes.
May I know the reason?
I have lots of appetite. I couldn't eat well. Then I used to have pains all over my body.
Okay.
And I've not been feeling quite okay recently.
Okay, all right. So you've been having lots of sleep and pain.
Yes.
Yeah. And where do you have pain?
On my chest.
On your chest.
Yeah.
Okay. And if I give you a pain score of 0 to 10, where 0 means no pain, 10 means the highest pain, where would you score it?
5.
5. Okay. Josephine, do you need any painkillers for that?
Yes.
Yes. Okay. After doing the observation, I will go and review your prescription chart. If there is any medication, I will give it to you, or else I will escalate you to the doctor. Is that okay?
It's alright.
Okay, Josephine, thank you. And before I do the observations, I just want to ask, are you comfortable or do you need the change of position?
I'm comfortable.
You're comfortable. Do you need to use the toilet?
No.
No. Okay, thank you. So I need to take your blood pressure, your pulse, your respiration, temperature, and oxygen saturation levels. Is that okay? Can I do it now?
Yes.
Okay, thank you. Josephine, I just need to go and get all the equipments needed. Meanwhile, here is the call bell. In case you need me, you can just press the buzzer. I'll be back in a few minutes. Yeah. Thank you. So I need my Dynamap, and I will please, Sir, can you please confirm it's calibrated and working? It's clean. Yeah. Okay, and the cuff size is appropriate for my patient, and next test due date is 2025. Okay, I need a tympanic thermometer. It's working. Next test due date is 2025. Okay, and the pulse oximeter also is working. Okay, so I will gel my hands again. I'll go back to my patient with my things. Hi Josephine, I'm back.
Okay.
So first of all, I need to check your blood pressure. Are you sitting comfortably?
Yes.
Are you have you crossed your legs?
No.
No. Okay, so which arm can I use for the blood pressure?
Use my left arm.
Left arm. Have you ever had any surgeries on your left arm?
No.
No. Okay. Can I expose a little bit your arm so I can see?
Please.
Okay. There are no redness. There is no signs of any infection. There is no fistula, no granula. So I'm happy to use this arm for the blood pressure. Okay. I just need to put the cuff on, and I will make sure that I put the cuff 2 centimeters above the antecubital fossa and 2 fingers loose. And when I press it on, it may squeeze your arm. Okay, so it will be there only for a few seconds. Don't worry about that. Okay. Yeah. All right. I'll put the cuff on. I'll turn it on now. Okay. Can I see your fingers, please?
Yeah,
okay. As I can see, there is no nail varnish, and your hands are not cold and clammy. And I need to check the capillary fill first. It's less than 2 seconds. I'm happy to put the probe on your finger. Which finger? Which finger would you like?
Just use anyone.
Okay. All right. I'll just put the probe on. Okay, I can see your blood pressure. I'll remove the BP cuff. I'll remove the pulse oximeter also. I can see the saturation level. And now, can I check your pulse for a few minutes?
Yes, go ahead.
Okay, I will take your, I'll check your pulse. Okay, I'll assume that it's already been 2 minutes. Okay, so Josephine, I checked your pulse and your respiration as well. Sorry, I didn't tell you earlier because because it may differ the results. Okay, because if we are checking the respiration and we tell the patient that we are going to check your respiration, it may get different results. Okay, so that's why I didn't tell you. All right, and the last thing, do you have any hearing aid on? No. No. Okay. So I need to check your temperature from the ear, and I will just visualize it. There is no signs of infection, no residual, and no discharge, and I can proceed. Okay. You will hear a beep beep sound. Okay. Yep. Okay. Thank you. I've taken your temperature also. Can you please give me a few minutes so I can record? Okay. Yeah. Go ahead, it's mouse. Okay, all right. So I will jet my hands again. I've recorded it, and just when your malnutrition screening tool with me, and which we completed when you came in, and it's for Josephine Noble. Date of birth is 14/11/1939. Your height is 5 feet 6 inches. Is that correct? And your weight is 65 kgs. Okay, and for the step 1 you have got a BMI score which is less than 18.5. So you've got a score of 2, and you have lost 5 to 10% in the last 3 to 6 months, and we have given you one score for that, so total score is 3. So when you have 3 score, which means we'll be referring you to the dietitian. We'll be referring you to the dietitian and nutritional sport team, who will set goals for you and increase and improve your overall nutritional intake. Is that okay? And we'll be monitoring you and reviewing your care plan as you are in the hospital. So every week we will do that. Okay, Josephine, don't worry about that. And if you can try to incorporate some fruits and vegetable in your diet, and try some small but frequent meals. It will help you to gain weight, and then yeah. Okay, you'll try that. Okay, thank you. And I just want to state your news chart aloud. So the observation which we got, your respiration was 20 and 0 score for this. Saturation was 96, 0 score for this. You are on room air, 0 score for this. Your blood pressure was 150/80, and we are counting only systolic blood pressure, and it's 0 score. Your pulse was 90, 0 score for this. You are alert, 0 score for this. Temperature is 36.4, 0 score for this. So you have got total new score of 0, which means we'll be monitoring you every 12 hours. And of course, if there is any if your clinical condition change, we'll monitor it. We will come and do the observations again. Okay, do you have any concerns before I go? Okay, I've made sure that I documented everything in your record, and I will escalate it to the doctor about your must score. And if there is any changes in your care plan, I will let you know as well. I will clean my trolley and keep it ready for the next user. I will finish the procedure with my final hand hygiene. Before I go, I just want to confirm, Josephine, are you comfortable? Yeah, do you need to use the toilet? Okay, and do you need a glass of water or change of position? No. Okay, thank you. And here is the call bell. In case you need me, you can just press the buzzer. Thank you so much for your time.